This morning's number is 80%. That's the percentage of people here in the United States who could be vaccinated by next summer. That's according to Moncef Slaoui, the head of Operation Warp Speed. That's the public-private partnership that's been established to help accelerate vaccine delivery in the U.S. Slaoui said that the U.S. would have to have about 75 to 80% of people vaccinated to achieve herd immunity, and said, quote, "We hope to reach that point between the month of May and the month of June." The rollout begins with 2.9 million doses, landing in 145 locations today, hitting all 50 states by Wednesday. Widespread inoculation cannot come soon enough. Deaths from COVID-19 in the U.S. are quickly approaching 300,000 and have exceeded 1.6 million worldwide. Bloomberg health reporter John Lauerman now joins us from Boston with the latest. John, it's great to have you on Quick Take this morning. This is obviously an enormous undertaking. How much of a challenge do you think it will be for the U.S. to vaccinate the majority of Americans by next summer, as Slaoui said yesterday would be possible?
Good morning. It's great to be with you. Yeah, this is a huge, huge challenge. I think it's also good to note that it's kind of unbelievable that we're here right now, less than a year after these vaccines began being developed. And now the challenge turns from developing the vaccine to actually getting them out the door and getting them to Americans all around the country. The vaccines are being shipped now from a factory in Kalamazoo, Michigan. We've received reports that some of them have already reached their destinations. And now they go into the hands of doctors, nurses, other medical personnel who are going to who are charged with the task of getting these vaccines into people's arms.
And there's
as you know,
yeah, go ahead.
As you might know, the vaccine has to be kept at ultra low temperatures, below 94 degrees Fahrenheit, while it's being shipped. And so this is just one of many challenges to getting the vaccine out to people. And of course, as you noted earlier, the supply right at this point is just 2.9 million doses. The other roughly 3 million doses that are available are being held in reserve so that we know there will be enough of that vaccine to get these the recipients a second dose in a timely fashion.
Right, because with this Pfizer vaccine, they need to be actually given the second dose in order for it to be as effective as possible. To what extent do the other vaccines that are in development right now and where they sort of are in the timeline, to what extent do they influence that what Slaoui said over the weekend when it came to the summer?
Right, exactly. It's a huge question mark. So the Moderna vaccine is going to be considered by FDA advisors later this week on Wednesday, I believe. And then, so that vaccine is actually looking pretty good. The data from that vaccine are very similar to the Pfizer vaccine. And the shipping situation with the Moderna vaccine is actually even a little bit better. It's a little bit easier to ship than the Pfizer vaccine. Then the next big question mark really is the AstraZeneca vaccine. That one has encountered some difficulties during the development. There were some side effects. And then you probably recall the dosing issues where some recipients of the vaccine in a trial who got a smaller dose actually did better than those who got 2 full doses of the vaccine. So jury's still out on that vaccine. The data from it looked good, but I think there are still some shoes left to be dropped in that story.
So does that sort of change the idea for when most Americans will be vaccinated because of the constraints?
I don't know if it changes it necessarily. I mean, Moncef Slaoui knows this. He knows this situation as well as anybody else. And if he says right now that he expects to have people vaccinated over that timeline, I have to give him. I certainly have to give him a lot of credit in that area. But I'm just saying that these are the question marks that face the vaccine scene right now. How
is the government deciding which states get what?
So they're doing that on a population basis. It's just an equation of which states have the biggest populations, at least for the time being. But the question of who gets it first, that's been recommended by the CDC. They've recommended that healthcare personnel and older people, nursing home residents, should be first in line to get the vaccine, although states are allowed to make their own determinations. President Trump had, or at least there had been reports anyway, that the White House was going to get some priority in terms of vaccine. But Trump tweeted overnight that the White House and top U.S. top U.S. officials would get the vaccine a little bit later. He also said that he himself has not been scheduled to get the vaccine.
Yeah, and I mean, he did get the coronavirus in October and recovered, so he should have immunity, according to health officials who say people who get the virus should have immunity.
Yeah, everybody's being recommended to get the vaccine, whether or not they've been infected in the past. There's no guarantee that that actually having been infected confers immunity.
Huh. All right, well, there it is. Bloomberg's John Lauerman in Boston. John, thanks as always for your time. It's great to chat with you this morning.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.